And as was mentioned, microbes as a trigger for vasculitis is certainly not new. We do know that there are certain types of vasculitis that have a known trigger, hepatitis C virus and cryoglobulinemic vasculitis, hepatitis B and polyarteritis nodosa, and streptococcus and IgA vasculitis. Of course, not all patients with these diseases have these triggers, but certainly the ones that they do, treatment of these infections leads to the cure, essentially, of their vasculitis. So there's a lot of attention being played on the gut microbiome, but in fact, we have microbes all over our body, on our skin, in our mouth, and in our nose. So I got interested in studying the nasal microbiome and granulomatosis with polyangiitis. Your nose has a lot of important functions, not just for breathing and not just for smell, but also it's an important site of active immunity. So if you've ever had a runny nose, you know your immune system is quite active in there. And in GPA, nasal and sinus inflammation is a very prominent feature. As was mentioned, there's been studies showing there's a higher rates of nasal carriage of Staphylococcus aureus, a type of bacteria, and that this is associated with a higher risk of relapse in GPA. And this led to this clinical trial of an antibiotic, trimethoprim sulfamethoxazole, or Bactrim, that led to less relapses. Now, there's been a lot of controversy as to how to interpret this, and some have debated that there could be anti-inflammatory effects of this antibiotic.